Hello and welcome. Today we're going to talk about meningitis. This project was done by Meyer, Lissy Frame, Jillian McLees, and Hannah Lewis.
A quick overview on what this presentation will be about is the background of meningitis, the different types of meningitis, background of bacterial meningitis, characteristics of Streptococcus pneumoniae, meningitis in the environment, signs and symptoms, methods of diagnosis, different treatments, and some fun facts.
So what is meningitis? It is often defined as the inflammation of the protective membranes, which are also called meninges, that surround the brain and the spinal cord. This kind of swelling is due to a bacterial or a viral infection. The infection typically depends on which type of meningitis the person has acquired.
There are 6 types of meningitis. There is bacterial meningitis, which is caused by bacteria, viral meningitis, which is caused by a virus, fungal meningitis, which is caused by fungi, although this type is rare. In addition, there is parasitic meningitis caused by parasites, amoebic meningitis, which is typically caused by Naegleria fowleri, this too is rare, and non-infectious meningitis, which can be caused by things such as cancers, lupus, and even brain surgery.
For this presentation, our focus is going to be on bacterial meningitis.
Just a little bit of background about bacterial meningitis. This is the deadliest form, and death can be caused in as little as a few hours. There is a high chance of recovery from infection. However, there is also a high chance of permanent disabilities due to infection, such as brain damage, hearing loss, and learning disabilities. According to the CDC, between the years of 2003 and 2007, during each year, there were 4,100 cases of bacterial meningitis, and out of these cases, there were 500 deaths. This is also associated with sepsis once it gets into later stages.
There are many different causes of bacterial meningitis in the United States. They consist of Streptococcus pneumoniae, Group B Streptococcus, Neisseria meningitis, Haemophilus influenza, and Listeria monocytogenes.
For the focuses of this presentation, we will focus on Streptococcus pneumoniae.
We will focus on Streptococcus pneumoniae. This bacteria is found worldwide. The human body is the common host for this bacteria, and Streptococcus pneumoniae is a gram-positive, non-motile, cocci-shaped microorganism, and cocci-shaped microorganisms are most likely found in pairs. It is mesophilic, and it uses fermentation to produce energy by converting the glucose into lactic acid.
It is spread in the form of aerosol droplets by way of sneezing and coughing. It is primarily located in the nasopharynx and travels through the lungs to the blood and crosses the blood-brain barrier, entering the meninges. Something interesting is the fact that a person can have the bacteria in or on their bodies without being infected. These people are considered carriers and can still spread to others.
There are many signs and symptoms of meningitis. Some of them consist of fever, headache, and a stiff neck. On the skin, there can be blotchy rashes that are bright red. Some other symptoms include nausea, vomiting, photophobia, and an altered level of consciousness. What sets aside meningitis from other diseases is going to be the more serious signs, which are a sudden onset of fever, headache, and vomiting.
In a study of environmental factors in the occurrence of acute meningitis in industrial countries, it was found that while factors have been associated with less developed countries, it hasn't been found to have a big correlation in the northern hemisphere. And in a study done in Italy during 2003, there were 50 cases of meningitis documented, which is higher than the average. These occurred in accordance with low temperatures and low humidity. However, these conditions could have affected the immunity of the pharynx, which could have made the host more vulnerable.
Different treatments for meningitis include intravenous antibiotics, corticosteroids to reduce inflammation, and replenishing of the lost fluids. Some common side effects found with the intravenous antibiotics are going to be swelling, pain, redness, and a hard lump at the injection site of the IV.
And lastly, we wanted to give you some fun facts about meningitis. First off, 1.2 million people die or become disabled worldwide each year due to meningitis. Secondly, each hour treatment is delayed for bacterial meningitis, there is a 3% greater risk of dying. And lastly, bacterial meningitis causes around 120,000 deaths globally each year.
Thank you so much for your time, and we hope that you were able to get a better understanding of bacterial meningitis. Bye!